Center test prep exam based. Question 1. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A, abdominal X-ray. Option B, abdominal ultrasound. Option C, CT scan of the abdomen. Option D, complete blood count. The correct answer is option C, CT scan of the abdomen. CT scan of the abdomen with full contrast is the most accurate imaging modality for diagnosing appendicitis, though ultrasound is often the initial test in children and pregnant patients. Question 2. Which of the following is an early, compensatory sign of shock? Option A, anuria. Option B, metabolic acidosis. Option C, tachycardia. Option D, unconsciousness. The correct answer is option C, tachycardia. In the early, compensatory stage of shock, the body attempts to maintain cardiac output and perfusion. Tachycardia and peripheral vasoconstriction are key early compensatory mechanisms. Question 3. In a multiple casualty incident, the triage tag for a patient with breathing 30/min, no radial pulse, and who does not follow commands is: option A, green, minor. Option B, yellow, delayed. Option C, red, immediate. Option D, black, deceased/expectant. The correct answer is option C, red, immediate. The START triage system categorizes this patient as red, immediate. Respiratory rate, 30 and altered mental status, doesn't follow commands, are both criteria for red. The presence of a radial pulse is a positive finding but does not downgrade the urgency. Question 4. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates: option A, damage above the midbrain. Option B, damage at or below the midbrain/brainstem. Option C, damage to the cerebral cortex. Option D, a positive outcome. The correct answer is option B, damage at or below the midbrain/brainstem. Decerebrate posturing, abnormal extension, arms adducted and internally rotated, legs extended, indicates brainstem damage below the level of the red nucleus and carries a poorer prognosis than decorticate posturing. Question 5. A patient presents with costovertebral angle tenderness, fever, chills, and dysuria. The nurse suspects: option A, cystitis. Option B, pyelonephritis. Option C, nephrolithisis. Option D, renal artery stenosis. The correct answer is option B, pyelonephritis. Pyelonephritis is an upper urinary tract infection characterized by systemic symptoms, fever, chills, and CVA tenderness, distinguishing it from lower tract cystitis. Question 6. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents: option A, uncompensated respiratory acidosis. Option B, compensated respiratory acidosis. Option C, uncompensated metabolic acidosis. Option D, compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. The low pH, acidosis, with elevated PaCO2, respiratory component, and normal HCO3, no metabolic compensation yet, indicates an acute, uncompensated respiratory acidosis. Question 7. When receiving a verbal or telephone order in an emergency, the nurse should: option A, carry out the order immediately without verification. Option B, write it down and read it back to the provider for verification. Option C, ask another nurse to take the order. Option D, refuse to take verbal orders. The correct answer is option B, write it down and read it back to the provider for verification. The best practice for verbal or telephone orders is the write down. Question 8. A patient presents with cramping abdominal pain, distension, vomiting, and high-pitched tinkling bowel sounds. These findings are most consistent with: option A, gastroenteritis. Option B, bowel obstruction. Option C, irritable bowel syndrome. Option D, acute pancreatitis. The correct answer is option B, bowel obstruction. The classic presentation of a small bowel obstruction includes cramping pain, abdominal distension, nausea/vomiting, and early high-pitched, hyperactive bowel sounds, borborygmi, that become absent later. Question 9. A patient presents with tearing chest pain radiating to the back. Blood pressure in the right arm is 190/100 mm Hg and in the left arm is 130/80 mm Hg. The chest X-ray shows a widened mediastinum. The nurse suspects: Option A, acute myocardial infarction. Option B, thoracic aortic dissection. Option C, pulmonary embolism. Option D, tension pneumothorax. The correct answer is option B, thoracic aortic dissection. The combination of tearing pain, blood pressure differential between arms, and widened mediastinum on chest X-ray is the classic presentation of a thoracic aortic dissection. Question 10. Which laboratory value is most indicative of acute kidney injury? Option A, elevated white blood cell count. Option B, elevated creatinine and BUN. Option C, decreased platelet count. Option D, elevated liver enzymes. The correct answer is option B, elevated creatinine and BUN. Elevated serum creatinine and blood urea nitrogen, BUN, are the hallmark lab findings of acute kidney injury, reflecting decreased glomerular filtration rate. Question 11. The priority patient for a trauma team activation based on mechanism of injury is: Option A, an adult who fell from standing height. Option B, a pedestrian struck by a car traveling 15 miles per hour. Option C, an adult ejected from a vehicle. Option D, an adult with a gunshot wound to the forearm. The correct answer is option C, an adult ejected from a vehicle. Ejection from a motor vehicle is a high-risk mechanism of injury that alone warrants trauma team activation and comprehensive evaluation, regardless of initial vital signs. Question 12. Which assessment finding is consistent with a flail chest? Option A, crepitus over the sternum. Option B, paradoxical chest wall movement. Option C, trickle deviation. Option D, subcutaneous emphysema. The correct answer is option B, paradoxical chest wall movement. Flail chest occurs when two or more adjacent ribs are fractured in multiple places, creating a free-floating segment. The segment moves paradoxically, inward during inspiration, outward during expiration. Question 13. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects: Option A, open-angle glaucoma. Option B, acute angle closure glaucoma. Option C, conjunctivitis. Option D, uveitis. The correct answer is option B, acute angle closure glaucoma. The presentation is classic for acute angle closure glaucoma, an ophthalmologic emergency. The sudden rise in intraocular pressure causes eye pain, cloudy, steamy cornea, a fixed mid-dilated pupil, and requires immediate treatment. Question 14. A patient receiving intravenous nitroglycerin for chest pain develops severe headache. The nurse should: Option A, stop the nitroglycerin infusion immediately. Option B, administer morphine for the headache. Option C, treat the headache and continue nitroglycerin as ordered. Option D, switch to oral nitrates. The correct answer is option C, treat the headache and continue nitroglycerin as ordered. Headache is a common and expected side effect of nitrates due to vasodilation of cerebral arteries. It is not an indication to discontinue therapy. Analgesics can be given while continuing the nitroglycerin. Question 15. A patient presents with a chemical eye splash. What is the priority nursing intervention? Option A, patch both eyes. Option B, immediate copious irrigation with water or normal saline. Option C, administer topical antibiotic drops. Option D, perform a visual acuity test. The correct answer is option B, immediate copious irrigation with water or normal saline. Immediate and prolonged irrigation of the affected eye to dilute and remove the chemical is the single most critical intervention to prevent permanent corneal damage. Irrigation should precede any other assessment. Question 16. A patient presents with sudden onset worst headache of my life. The nurse's first priority is: Option A, administer pain medication. Option B, perform a complete neurological assessment. Option C, prepare for lumbar puncture. Option D, obtain a non-contrast CT scan of the head. The correct answer is option D, obtain a non-contrast CT scan of the head. The sudden thunderclap headache suggests a subarachnoid hemorrhage. A non-contrast head CT is the first diagnostic test to rule out hemorrhage. Lumbar puncture follows if CT is negative and suspicion remains high. Question 17. The emergency nurse suspects acute epiglottitis in a patient presenting with option A, inspiratory stridor, drooling, and tripod positioning. Option B, barking cough, low-grade fever, and hoarseness. Option C, productive cough, pleuritic chest pain, and fever. Option D, wheezing, prolonged expiration, and accessory muscle use. The correct answer is option A, inspiratory stridor, drooling, and tripod positioning. The classic triad of epiglottitis includes inspiratory stridor, drooling, from inability to swallow, and the tripod position, leaning forward on hands. This is a life-threatening airway emergency. Question 18. A female patient of childbearing age with abdominal pain should always be evaluated for option A, ovarian cysts. Option B, pregnancy status. Option C, endometriosis. Option D, PID. The correct answer is option B, pregnancy status. Any female of childbearing age with abdominal pain requires determination of pregnancy status to rule out life-threatening ectopic pregnancy before other diagnoses are considered. Question 19. The purpose of administering surfactant to a patient with ARDS is to option A, bronchodilate the airways. Option B, reduce alveolar surface tension and prevent atelectasis. Option C, decrease pulmonary capillary permeability. Option D, increase mucociliary clearance. The correct answer is option B, reduce alveolar surface tension and prevent atelectasis. Surfactant reduces surface tension in the alveoli, preventing alveolar collapse, atelectasis, and improving gas exchange in conditions like ARDS. Question 20. The hallmark sign of compartment syndrome is option A, pain relieved by elevation. Option B, pain out of proportion to the injury. Option C, absent pulse in the affected extremity. Option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Pain that is severe, unrelenting, and disproportionate to the physical exam findings is the classic early sign of compartment syndrome. Pain with passive stretch of the muscle is also characteristic. Pulselessness is a late and ominous finding. Question 21. Necrotizing fasciitis requires what priority treatment? Option A, broad-spectrum antibiotics alone. Option B, immediate surgical debridement. Option C, hyperbaric oxygen therapy. Option D, wound vac placement. The correct answer is option B, immediate surgical debridement. Necrotizing fasciitis is a rapidly progressive soft tissue infection requiring aggressive, emergent surgical debridement of all necrotic tissue. Antibiotics alone are insufficient. Question 22. The classic triad of symptoms for a ruptured abdominal aortic aneurysm, AAA, includes option A, hypertension, bradycardia, headache. Option B, abdominal pain, hypotension, and a pulsatile mass. Option C, fever, chills, flank pain. Option D, dysuria, frequency, urgency. The correct answer is option B, abdominal pain, hypotension, and a pulsatile mass. The classic triad is abdominal or back pain, hypotension, and a palpable pulsatile abdominal mass. However, the triad is present in only a minority of patients. Question 23. The most common cause of lower gastrointestinal bleeding in adults is option A, gastric ulcer. Option B, diverticulosis. Option C, desophageal varices. Option D, Mallory-Weiss tear. The correct answer is option B, diverticulosis. Diverticulosis is the most common cause of lower GI bleeding in adults. Upper GI bleeding is most commonly caused by peptic ulcer disease. Question 24. The safe harbor provision for nurses typically refers to option A law that provides legal immunity in all circumstances. Option B, A process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C. A hospital policy allowing nurses to refuse any assignment. Option D. The requirement to report all medication errors. The correct answer is option B. A process where a nurse can request a peer review of an assignment they believe is unsafe without immediate fear of retaliation. Safe harbor laws allow a nurse to accept an assignment they believe is unsafe but to invoke a formal review process that provides a degree of protection from licensure action or employer retaliation. Question 25. The best method to remove a prosthetic eye in an emergency is: Option A. Using forceps to grasp the prosthetic. Option B. Applying suction with a bulb syringe. Option C. Using a suction cup designed for prosthesis removal. Option D. Sweeping a finger around the edge to break the suction. The correct answer is option C. Using a suction cup designed for prosthesis removal. A small suction cup designed for this purpose is the safest method. Alternative methods can damage the prosthesis or the surrounding tissue.